Hello everyone and welcome back to Medi Notes for Medicos. The topic that we're going to deal today is about HAI, that is Healthcare Associated Infection from Microbiology. The objectives are the interaction types: bloodstream infection, ventilator associated pneumonia, urinary tract infection, surgical site infection, transfusion associated infections, post-antibiotic diarrhea, surveillance for HAI, and monitoring and regulation of HAI. So what is HAI? HAI means healthcare associated infections. It is known as the infections that has an onset after 48 hours when we admit a patient or a patient's procedures in the hospital formalities has been completed, and up to 30 days prior its discharge from the hospital. And in case there is a surgical incision done, within 30 days the infection should occur. In case of prosthetic material implantation at surgery, we give them 90 days or 3 months. It is influenced by the interplay between the host, pathogens, and the environmental factors. Now, what are the types of infections present over here? We gain infections in hospital via bloodstream. We by ventilator, mostly it causes pneumonia, urinary tract infection. Then we have blood transfusion associated infection, surgical site infection, and post antibiotic infection. So we'll start with the bloodstream infection. So there are two types of bloodstream infections. One is catheter based bloodstream infection, and the second is central line associated bloodstream infections. The common pathogens that is associated with the bloodstream infections are E. coli, staphylococcus, that is MRSA, that is methicillin resistant staphylococcus aureus, Klebsiella, Pseudomonas, Acinetobacter, and Enterobacter. So what are the risk factors for the bloodstream infection? If the if there is a central or peripheral line, if the patient is immunocompromised state, or there is a total parenteral nutrition being given to the patient, or the patient is at end stage renal failure. So what are the methods of prevention? The first is we have to give a proper care or proper preparation before we insert either the catheter or the central line. And then we have to take care of the IV lines. Next is CRBSI. This is catheter related bloodstream infection, and this is suspected if the following criteria are fulfilled. So if a pathogen uh, if the central line shows 3 times more the pathogens in the peripheral lines, then it is suspected to be CRBSA. Also, the growth of the bacteria would be seen before in the central line on comparison to the peripheral line. Now, the number of colonies would be more in central line than the peripheral line. If these three criteria are met, then we say that it is a catheter related bloodstream infection. Now, why does this infection occurs? It might be because of improper catheter care, and there are of two types. One is exit site infection, the other is the tunnel site infection. Now, exit site infection, you would see an inflammation around the exit site of the catheter, and it would measure less than 2 centimeter area, and the culture would show positive exudate presence. When we see the tunnel infection, the inflammation would be extending from the vein to the entry side, and the confinement of the area of the inflammation would be greater than the 2 centimeter, and this would be associated with pain, tenderness along with subcutaneous tract along the subcutaneous tract, and you would see positive bacterial growth. So in exit site infection you would be seeing culture positive exudate presence, while in tunnel infection you will be seeing a positive bacterial growth. The next is CLABSI. So what is CLABSI? It is central line associated bloodstream infection. In this, the risk factor is the patient would be having the ones those who are supposed to be looked into for this is the patients who have a blood culture of more than one, uh, which of the having a presence of organisms that are on the skin type, or one organism that isn't present on the skin, and the patient should have central line during the infection or within 48 hours prior to the development of the infection. The central line should have been there with the patients. Next is VAP. VAP means ventilator associated pneumonia. This affects the lower respiratory tract. During this pneumonia, we should make sure that no sort of instrumentation or aspiration should be done on an unconscious patient. Why? Because it can lead to nosocomial pneumonia. The most common organisms that causes this is MRSA, Acinetobacter, Klebsiella, Pseudomonas and gram-negative bacilli. So the most chances of this pneumonia is uh, basically when a patient has undergone endotracheal intubation post 48 to 72 hours, this would come in action. So what are the criterias? New or extensive infiltrates would be seen, or we can see fever or hypo or hypothermia. We would be seeing an increased WBC count, and we can also see sign of acute respiratory distress and detection of causative agent of the endotracheal or bronchoalveolar lavage, or our PO2 slash FiO2 would be greater than 240. So how can we prevent it? We can prevent it by providing ventilator care and giving them respiratory physiotherapy. The next is urinary tract infection. The most common organism that causes urinary tract infection is E. coli, Proteus and Enterococcus. The risk factor is catheter. How can we prevent it? We can prevent it by giving a proper catheter care, appropriate types of catheter in case there is a long-term use. Now what is COTI? COTI means catheter associated urinary tract infection. It is one of the most common hospital associated infections that affect almost 2% cases of the hospital. These are caused by, as I said already, it's caused by E. coli, Pseudomonas aeruginosa, Proteus and other negative gram bacilli, and mixed infection can also be seen here. Next is SSI. SSI means surgical site infections. The risk factors are in case there is a prolonged surgery or there is surgical drains done. The causative organisms are MRSA, E. coli, coagulase negative staphylococci. And how can we prevent it? We can prevent it by providing surgical prophylaxis, and we can give proper wound care and dress. It mostly appears within 4 to 5 days if it is staphylococcal infection, and if it is gram-negative bacillicost infection, it occurs after 6 to 7 days. So what is TAI? TAI is transfusion associated infections. This occurs when we give a patient transfusion or they are undergoing renal dialysis. These people are at the higher risk of having blood transfuted diseases such as HPV, HCV, HIV, etc. The next is post-antibiotic diarrhea. This is a diarrhea that is caused by Clostridium difficile. This occurs basically when a patient is having a prolonged antibiotic therapy, and the method of prevention is by reducing the duration of the therapy or by giving them probiotics. So what happens over here to cause diarrhea is it causes the normal flora of the gut to get suppressed due to the antibiotics. Next is surveillance. So there are three types of surveillance that we would be doing. One is passive surveillance, second is active surveillance, and the third is sentinel surveillance. The passive surveillance is the routine surveillance that we do to monitor any sort of infections that is occurred by the HAI in microbiology laboratory generated by the infection control team. And next is the active surveillance. They monitor actively for the presence of infections in patients, for example, COTI, that is catheter associated urinary tract infection, surgical site infection, VAP, CRBSI. Then we can they will be doing an environmental surveillance, example monitoring of the water contamination, Then surveillance of the isolated microorganism to trace if they are capable of causing any sort of infection. Then checking for the quality control in central sterile supply department for optimum sterilization of the instrument, equipment, linen. Then behavior surveillance of the healthcare personnel by auditing infection control practices among the health workers. Next is the sentinel surveillance. So this is a targeted surveillance, for example, in diseases such as TB, which is an important term in communicability and morbidity and mortality among the particular society by characterizing the agent. Next is the monitoring and regulation. So every hospital has HICC team, that is Hospital Infection Control Committee team. The functions of this is to meet periodically to evaluate the infection rates that is occurring in the hospital. They review and audit the infections that has of the control done for the infection. Then they look for any sort of infrastructure correction and personal requirements to prevent the spread of these diseases. They review the procedures to detect and investigate hospital outbreak of infections. They strategize containment of outbreaks and implement preventive measures. They review and monitor training HCW. They review the AR patterns in the hospital and update guidelines and antibiotics policy. Then they review the surveillance report of critical areas in hospital and they advise management of improvement of architecture, structural and functional aspects for the control measures. So that was the video for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to our channel. We'll be coming with more videos. Till then, happy learning. This is Ashna Viraju signing off for today. Bye.